Welcome to Whole Health. We're happy you're here on this journey of exploration with us as we learn what it means to live a life dedicated to spiritual, mental, and physical health. Before we begin our program, we want to share a brief legal disclaimer. The information provided on this program, including any health-related advice or discussions, is for general informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before making any decisions regarding your health. Now, let's turn it over to Pastor Jeremy, Dr. Kala Kleen, and Brittany Pfeifner for today's episode of Whole Health.
Welcome back to Whole Health. We're glad you're here. Today we're diving into something that literally affects every single person that's listening, and that's health insurance. Specifically, why costs have exploded over the last, say, 20 to 30 years, how insurance plans are actually designed, why prevention often gets pushed aside, and what's all of this mean moving forward. And honestly, this topic gets emotional pretty fast because almost everybody has, had that experience, that moment where they say, wait a second, I have health insurance and it still costs how much? And so, Dr. Kala, can you wade us into this conversation?
Yeah, absolutely. I'm excited to talk about this very topic because it's something that comes up many times, many conversations throughout our day in the healthcare office. And people are frustrated because healthcare continues to be incredibly confusing. Delay of getting care and access to care. I know just trying to get into the doctor, you call and they'll send you to an urgent care because they are so full that day. But patients are paying more than ever, and many feel like they're getting less access, less time, and fewer proactive options.
Right. So let's start broad. Why does it feel like health insurance got dramatically more expensive over the last couple decades?
Yeah, so over the last 20 to 30 years, we've seen significant increases in monthly premiums. Deductibles are getting higher and higher. When I started in 2009, a high deductible plan was like $500 to $1,500, and people were shocked by that.
Right. Oh my goodness.
Because for so long, so many people were used to 10% or 20% coinsurance or just a flat $20 copay, no matter where they went. So when the deductibles started going up, it started to actually even change behavior. But we also see prescription costs going through the roof, the hospital costs, administrative overhead, and then just the overall utilization of healthcare. So years ago, insurance functioned more like a partnership to help people access care. Now, for many families, it functions more like a catastrophic protection, meaning you pay a ton every month, but still often feel like you're paying cash until something major happens. Personally, my own deductible is $10,000 for our family, and the goal is to not hit the deductible. But then again, depending on we have insurance that is provided by my husband's employer, and his employer does pay a portion. We still also pay a proportion. But when we do the math, regardless whether his employer and his additional contribution, I think we spend $21,000 before we have $1 of coverage reimbursed, to put it in perspective. But healthcare costs didn't rise for one single reason. It's a combination. The cost of advancing technology, more expensive hospital systems, higher prescription drug prices, increasing rates of chronic disease, administrative complexity, and the consolidation within healthcare systems. Fewer companies now own more pieces of healthcare, so even when more people insured, the system itself has become dramatically more expensive to operate. All the patients and patients feel what we hear. I have insurance but can't afford to use it, and that's become incredibly common. I remember years ago, my dad was talking about his recent hospital bill, and he's like, why did the Band-Aid cost $15 on his itemized? And I had to explain, I'm like, Dad, the nurse had to see that you needed it, had to clean the wound, the lights in the building, the malpractice, the doctor to order it and to overview the notes, the billers, the coders. I'm like, for that one Band-Aid, there was 15 people that had to be paid in order to get your insurance to reimburse for that.
It's interesting to think of that way because I've looked at those and gone, I've really asked the same question. So it does make more sense from that perspective, but it's still absurd.
Yeah. So oftentimes, people avoid then going in because of the unknown cost. They don't know if they want the imaging or the labs or the therapy, the specialist visits, even doing the preventative care. And it's the fear of the unknown cost or just the cost in general.
Right. So people aren't necessarily uninsured. They're just under accessing care because of the cost of the care.
Yes, exactly. And then, like I said, that changes behavior. They delay care because of the symptoms. So then, unfortunately, people are getting worse. And oftentimes, then it develops into either a more complex or multiple system issue.
Man, so who are the biggest players in health insurance right now?
Yeah, so across the United States, we've got United Healthcare, Elevance Health, which used to be Anthem, Aetna, which is also then partnered with CVS, the drugstore, Cigna, and then Healthcare Service Corporation, which operates several different Blue Cross Blue Shield entities. And then you also have large payers like Humana and Molina, especially in the Medicare Advantage and the Medicaid managed care plans. It's something important that people don't realize that these companies are massive corporations.
Right.
They are vertically integrated now, meaning they may own insurance company, pharmacy benefit managers, clinics, urgent clinics, specialty pharmacies, data systems, and even provider groups. So healthcare has become incredibly consolidated as well.
It seems like a bit of a monopoly to some degree as well. And it's probably important to mention there are alternative options, maybe Christian healthcare companies that, come alongside of folks. For instance, Samaritan Ministries is out of Peoria, Illinois. There are a number of people in our church that use that. It's interesting, if you look at their website, it actually says it's not insurance. It's a community of people that pay each other's medical bills. So we're certainly not suggesting to go that route, but it might be something that if you don't have a traditional health insurance plan that could benefit you. But, it does seem like a lot of these, if they're owning so many different aspects of the healthcare industry, that monopoly can, keep them, or keep us, I guess, from challenging them on their rates and these things, because they own all of it. So you mentioned pharmacy benefit managers. That's interesting. Most people have probably never heard of that. So maybe tell us what that means.
Yeah, it's probably one of the least understood parts of healthcare. So the PBM, or pharmacy benefit managers, sit between the drug manufacturers and the insurance companies and the pharmacies. So in theory, they negotiate drug prices and help manage prescription coverage. But in reality, it can become incredibly complicated, because now you have formularies, which those are like what's the formulation or the compounding of the medication, and then you have preferred drug list, rebates, prior authorizations, and then step therapy requirements. So can we complicate something that's even more complicated?
I thought I understood it, but now I don't.
Yeah. Patients often have no idea why one medication is covered, why another is denied. Oftentimes, too, I'll see patients, they turn 65 and they get Medicare, so something that was approved on a Blue Cross Blue Shield plan, now it's not part of the Medicaid covered, or they will be on the name brand, and the Medicare or Medicaid now only covers the what's the name? The generic.
Right. I had an experience like that. I have a form of GERD because of a injury from surgery, and I have to take pantoprazole every day, which is a proton pump inhibitor. And I was told about a prescription newer to the market that is better and may have less side effects, although I really don't know that I've experienced side effects from it. I'd love to be off of it. I know that's conversations we had and are working towards. But this newer version, the person that I heard it from, their insurance covered it. It was the same price, like $20 for them to pick it up. My insurance didn't cover it. And so I would have been thousands of dollars out of pocket monthly in order to get this. And then you can go to their website and try to fill stuff out, and maybe they'll help comp part of it to you. And it ultimately got so difficult that I basically ran away from the whole idea and just stuck where I was at, again, working towards getting off of it anyway. But I get how that works. It's frustrating. There's a lot of options out there. So let's simplify insurance plans for people, because honestly, I think most people don't fully understand their own plan. I've talked to my insurance agent a number of times, and I think, and I love him. Aaron, you're a great guy, but it gets more confusing the more I talk about it. So maybe help us out a little bit.
Yeah, and I think most people don't actually understand it until they have to use it. If you just kind of have it in the background, if you aren't someone who utilizes it a lot. But we're just going to go over the basics, because at least in our office, we'll have people come in, especially the younger population will come in, and we'll be like, okay, this is going to go to your deductible, and they don't know what that means.
Right.
So health insurance has a couple of things. Your premium, that's what you pay every month just to have it. Okay, so it costs you money every month just to have it. And then your deductible is what you're going to pay out of pocket before insurance starts to pay anything. So there are different plans. So like my plan, I have a deductible, but only certain services go towards that, and other services don't. So it depends. If you have a high deductible plan, that deductible is going to have to be met before anything else gets paid first. There's copays. Those are just your flat fee. So it could be like, $20, $25 per visit. And that also varies for specialists versus non-specialists. So even that's not consistent, even though it's a flat fee. Right. So us as a chiropractor chiropractic office, we have people come in and we sometimes fall under a PCP and sometimes we fall under specialist. And we don't always know. Sometimes
Wow.
Blue Cross will do different ways for different plans. So we always just do our best to, let them know. But even just in our office, we see that being different.
Sure.
Then you have coinsurance. That's the percentage that you're going to pay. It can be after your deductible. So once you hit that deductible, then you have your coinsurance to 10, 20%, whatever. It can be before your deductible as well. If you have a good insurance plan, it's like you may just pay that 10% for some services and some other ones may go to your deductible.
Wow.
So I don't think this helped clarify anything because it's very specific to your own plan.
Right.
But so it's like, so if someone says they have a $7,000 deductible, that's how much they're going to pay before insurance is really going to do anything for the most part. So that's why people are feel like they're paying cash prices and their premiums basically in case, their kid breaks a leg or something happens that they actually are going to meet that deductible, and hopefully they don't.
Well, even a broken leg still wouldn't get you
True.
to 7,000.
Yeah. I was like, not to
Which is
7,000. Yeah. Maybe with all the follow-ups, my kiddo broke a leg. It was quite a few visits.
Sure.
But so there's a lot of times a high deductible, there are advantages and disadvantages to either one. A high deductible usually means you have a lower monthly premium, but higher upfront costs when you actually use the care. So it's cheaper monthly if you're not someone who goes to the doctor a lot. Maybe you are under functional or integrative care, and that's your main source of insurance isn't covering that. This may be a better option for you.
Right.
People with family and kids and have the unknown of you just never know if you're going to go to the trampoline park and something's going to happen. That might not be the best option, but a lot of times the lower deductible, higher premium plans will be a higher monthly payment, but then they, lower deductible, more, insurance coverage in that area. So those might make more sense for families, people with chronic conditions, a lot of medications, or if you're going to have a surgery. I know any year that we're going to have a baby, I know I'm like, all right, we're having that lower deductible because that just makes more sense.
Right.
So, another part of this is in the recent, last 10 years, a lot of employers have shifted towards a high deductible plan. So you might not even have a ton of options when it comes to what you want for your coverage to be, just because premiums became just so outrageous. I know when we have very good insurance, we're very fortunate in that, but we get it every year to look through it and we see what my husband's employer is paying versus what we're paying.
Sure.
It is outrageous.
Wow.
The amount of money that these plans cost. But it's another important distinction is when we talk about insurance and healthcare, it's not the same thing. They're so interconnected because you don't have to have one for the other to get care. When people call our office, we're like, okay, do you have insurance? It's something we need to know, unfortunately, because if you want to be able to use your benefits, that does, kind of dictate care a little bit. But healthcare is the actual care you're getting. So the guidance, prevention, treatment, things like that, that's healthcare versus insurance is just the payment portion of it. So that's coverage does not always equal access, though, and I think we'll get into that a little bit further.
I think staying on the topic of access, let's talk about the ACA. Of course, the Affordable Care Act. Some people call it Obamacare, because even years later, it's still one of the most debated healthcare topics out there. So, Dr. Calla, at a practical level, what did the ACA actually change?
Yeah, so it did several major things. It expanded access. It protected pre-existing conditions because before, I think 2008, health insurance policies would do a background on your health and health history, and they can deny coverage for some of these pre-existing conditions. Right. It standardized some essential health benefits. So think about what your health care determines as preventative was determined during that ACA expansion. It expanded Medicaid in many states and then created a marketplace plan with tax subsidies. For many people, especially those previously denied coverage, it absolutely increased access to being able to capture insurance. But what's important to understand is the ACA didn't make healthcare cheap. It made insurance more available, and those are very different things.
Right. And now we're heading into subsidy concerns again. What does that actually mean?
Yeah, so insurance subsidies are financial discounts provided by the government to lower or eliminate the cost of healthcare coverage. And it's the cost of the consumer. The cost is still there.
Significantly.
Yes, enhanced ACA subsidies dramatically reduced monthly premiums for millions of Americans over the last several years. As those subsidies expire or shrink, many people are going to see major increases in monthly costs, and that matters because healthier individuals drop coverage due to cost. Risk pools become sicker overall and can drive up premiums even higher. And again, behavior changes. People are going to delay those preventative services, the early interventions, the health coaching, the movement, and metabolic testing until they're finally sick and symptomatic enough.
Right. That's a huge one. Explain the difference between standard of care and medical necessity.
Yeah, so this is a misconception in healthcare. The standard of care means what a reasonably trained provider would do based on the evidence, guidelines, training, and acceptable practice. There is a thing that many hospitals have. It's called the UpToDate. I think it's, I can't remember, you can literally Google uptodate.com, but it's usually like a yearly service, and you can type in what are the symptoms, and it will spell out what is the standard of care. For instance, when Jill Reese and I started working together, I said, hey, go check out the vitamin D, what it says the UpToDate is on the vitamin D on somebody who has low vitamin D. And so she's, working at the hospital, and she looks it up, and she's like, I cannot believe how outdated this is, that they were only, I think the UpToDate, please don't, I think it said at the time 1 to 2,000 IUs if they have low vitamin D was like the standard. And in our office we put people on we have a tablet that has 50,000 IUs of vitamin D in there.
I'm like way over that.
Yeah. Well, and it's funny. My mom's orthopedic surgeon, ironically, was the doc on call when my dad broke his hip. And I walked in the room and he looked at me and he's like, what do you think your dad's vitamin D is? And I was like, well, Dad, you've been taking your vitamin D, right? And he's like, well, I sometimes miss. And he's like, well, it's a rockin' 7. And he knew me from my experience with my mom's surgery. And he's like, do you want to go get the 50,000 that I know you have at your parents' house?
Right.
Because he legally could not give my dad more vitamin D before he went into a surgery on a bone.
Unbelievable.
Yeah. But then there's medical necessity, and that's an insurance definition, meaning does the insurance company believe this service is necessary enough to qualify for payment under their policy criteria? And those things are not always the same. So things that meet medical necessity in Iowa for certain care might not meet medical necessity in Wisconsin based on Wisconsin plans. Wow. So geography does play a role in this as well.
We were up in Wisconsin a few years ago. Kind of a wild experience. It's where we learned our son was allergic to tigers, which...
Oh, sure.
Yeah, you're going to want to learn that, apparently. But we were at the Kalahari, and they had a tiger in the entryway, a baby tiger. I have a picture of it I can show you. And they were like, oh, for $5, you can go over there and spend 10 minutes with it. And so as a family, we were like, this is amazing.
I'm going to play with the tiger
Let's
today.
take him with us. But we spent 6 hours in the ER that night, and... our insurance didn't cover the need. We got back here,
which you think would be emergent,
right? It was very odd, but the saliva and the fur turned out our youngest Aiden was very allergic to it, and we ended up finding out from that it's similar to some dog allergy things, but. We found out here that our insurance would have covered it here, but there we ended up paying like $13,000 for that visit. So, yeah, you're going to want to know those things before you take a vacation, and maybe Google, am I allergic to, how do you find out if you're allergic to tigers?
Before you go. Yeah, so oftentimes patients will think if my doctor recommends this, insurance should cover it. But insurance companies may say there's not enough failed conservative care, the symptoms are not severe enough, there's not enough documented dysfunction, not enough progression, not enough evidence according to their criteria. So something can absolutely help a patient and it still not be covered.
Wow, so it's really where prevention enters the conversation, right, Brittany?
Yeah, because our healthcare system is really good at crisis. Like if you are if you have an acute thing going on, that's where you want to go. They're good at trauma, emergency medicine, surgeries, those things. But it's not designed. And I know we've talked about this before, but prevention, it's not incentivized. And hopefully that's going to change into the MAHA movement. I know that's part of the plan, right? Is prevention, but it's hard to measure that. And insurance companies operate year to year. So but prevention plays off 5, 10, 20 years later, right? So now this is where they wait until it's, may not be medically necessary now. And now we're waiting 5 years and now maybe it is. So that's why patients feel frustrated when they can't get coverage for the proactive labs that we love to run in our office. Nutrition support, fitness, intervention, metabolic optimization, recovery, just any functional medicine, those types of things until the disease is pretty advanced. I've had probably 4 patients in the last week that have undergone, had their normal lab testing for the year. And they've had providers who are pretty great and have done more than just the standard. And even then, and I love our relationships with, local providers, because they even know, they're like, hey, I cannot run this, but you should go to this office because I think you would really benefit from it.
Wow,
and like,
that's awesome.
luckily these patients have those providers who are doing that for them. And they come in, they're like, hey, these are my previous labs. I'd like, what else do you have that can give me a better picture? Especially for women with like, hormone issues or metabolic concerns. They're just like, yeah, I know we've talked a million times about getting that fasting insulin is like so impossible to do, but just those types of things, if you don't have that connection, you're just going to get the basics, and then you might be missing information that would be really beneficial.
Right. So let's shift gears a little bit. People listening might be thinking, this system sounds expensive and overwhelming. So what can I actually do? How can people realistically reduce healthcare costs for themselves and for their families?
Yeah, so one of the biggest ways is being proactive instead of reactive. And I know we talked about that on the last episode, but it seems counterproductive, like right now, if you're spending all this money up front, but the most expensive healthcare usually happens years after dysfunction, with the inflammation, the stress, poor sleep, sedentary lifestyle, metabolic decline. And so it's not about being perfect and doing everything right, but stacking those small habits consistently over time. So it's, talking about like pay now or pay later. I'd rather pay now and feel better than have to pay later and manage disease, right? So you're either investing your time and your effort into, nutrition, hydration, sleep, movement, just, trying to optimize health now so you can actually live well, or eventually you're going to be paying, financially, physically, emotionally, sometime later in life. And so, and it's a mindset shift, because people think, healthcare starts when they get sick. And a lot of people don't even realize that they feel sick until they feel better.
Amen.
So many people come to the office, they're like, it's been on a decline for such a long time that they don't even know what normal feels like for them, And unfortunately, a lot of times that's what it takes to get someone to come in. There's a lot of, there's, financial costs, time, or just prioritizing yourself. Like moms, they'll be like 7 years postpartum, they'll finally come in to get their stuff done, because like, okay, I finally have like the mental space to try to, work on me. But true healthcare should start long before our disease develops. So we don't want to manage disease. We want to be, how do I reduce my likelihood of needing the healthcare, as I age in the first place? So, yeah.
Yeah, I think that's incredibly important. So what's actually driving the majority of healthcare spending?
Yeah, so when we look across the board, and insurance companies will reveal this, hospitals will reveal this about what's coming in. Even Jill Reese, working in the emergency room, she thought she was going to go into emergency medicine to, be getting the broken bones, the stuff that's emergency doctors love, like the real trauma, and that's where they excel. But what happens is in the emergency room is they're actually treating chronic diseases and complications of chronic diseases.
Oh, wow.
So a massive portion of chronic disease is heavily influenced by lifestyle behaviors. So when you say what is the drivers of the metabolic diseases, 80 to 90% of the healthcare spending goes to things that are preventable and reversible.
Wow.
So the biggest drivers are connected to inactivity, poor nutrition, obesity, insulin resistance, poor sleep, chronic stress, smoking, alcohol overuse, dehydration, lack of muscle mass, and metabolic dysfunction. And those conditions don't happen overnight. Those happen over years and years and years. People don't wake up one day and all of a sudden they're type 2 diabetic. They don't all of a sudden have cardiovascular disease or metabolic issues, osteoporosis, or a chronic inflammatory disease. Those are often decades in the making.
So let's talk movement, because I think people underestimate how important basic movement can be.
Yeah, and oftentimes too, people don't want to hear this if they're not already doing this, and I don't blame them. I had a young
just give me a pill and I'll sit over here.
Yeah. But it's just undeniably of all of the studies when it comes to health, fitness moves and wins time and time again. Very rarely is there a study that shows exercise and movement is bad for your health. Where those exercises that it could be bad for your health is the overtraining and undernourishing. But movement affects blood sugar regulation, insulin sensitivity, inflammation, circulation, lymph drainage, bone density, brain health, mood, hormones, cardiovascular health, muscle mass, balance, longevity.
Wow.
So basically every system in the body, and it doesn't mean to becoming a marathon runner or a CrossFit CrossFitter overnight.
Well, thank God.
Yeah, prevention starts with walking daily. I'm really a big proponent. Somebody asked me if the weighted vests are a fad. I'm like, they shouldn't be a fad
Right.
if we're taking health seriously. Resistance training twice a week, drinking more water, sleeping consistently, eating more protein and whole foods, getting outside, and managing stress better. Oftentimes, though, people, if they're pretty sedentary right now, it is shocking about just like little baby steps over time where it might seem like it's impossible. I often hear too, people are like, well, I don't move because the more I move, it hurts. Well, there's things that they can do. If we had some of those biomarkers to understand, there are some people that they come in that they're metabolically so inflamed that I actually do believe that I'm sure that the more that they move those joints, absolutely it's going to make them feel worse. Sometimes it'll be an inflammatory cascade on itself. But again, those people still have opportunity from where they're at in their baseline to drastically reduce and improve overnight.
I love that. I love that phrase, your health compounds, because people understand compound interest financially, but not always physically.
Yeah, and that's such a good analogy because your health behaviors either compound for you or against you, right? So muscle mass compounds. If I just work out one day, nothing's happening, right? But over time, you get to start to see some really good progress. So your metabolic health, inflammation, but also stress compounds. So the more that we don't manage it or find it's impossible to not have any stress. But if we need to be appropriate in how we go about it and like get good techniques to cope with it, sleep deprivation compounds. And I know that's so hard. I have a lot of moms, and literally today I was just telling her, and she's like, what can I do to help this? I was like, sleep is pretty foundational. I was like, I know that's impossible for you to hear. You have kids that wake you up all night. So here's some other components. But if like for me, I still have a kiddo who wakes me up at night. And so I just make it a priority to go to bed earlier than I want to go to bed because I know that I'm going to be interrupted. So my sleep total is still going to be what I need it to be. I just lose an hour of alone time to myself beforehand. But for me, like I notice such a big difference when I make that a priority. So
and it's a season of life. You invest in that season and it pays off.
Absolutely. Yeah, it's not forever. It's just when you're in the thick of it, sometimes it feels like it is. But the thing is, a lot of people won't feel the consequences of these things until years later. But the positive is, like, small habits also compound. They make a big difference. So literally just drinking enough water. That's such a lame thing to do, but it makes such a good...
It's hilarious how many people don't drink water, though. I have a good friend, who he only drinks coffee, really. And I'm always on him, like, you need to drink water. I do. I filter it through my coffee. and it's like, that's not quite the same thing. But it is. It's such a strange thing that it's something you have to encourage people to do. Drink water.
Absolutely. We did like the water challenge in the office, and everyone was like, there's several of them who just blew it out of the water. I was like, how do you guys, like, they're drinking like 170 ounces a day.
Wow.
I'm like, that's crazy. But it really did also push a lot of us to be like more accountable, to be like, okay, I need to like not another coffee. I need some water, not just, in my protein shake.
Yeah. Our office did a sleep challenge and a water challenge. And it was interesting to see like the data and the metrics, and me and Brittany are like, why are all the moms sleep deprived and like the busiest people, but yet the ones that don't have kids yet are crushing it?
Well, there you go.
They were getting like 8-9 hours of that. Yeah. And I was like, wow,
these unicorns
seems awesome. But other good habits of just like walking daily. That like I've had a handful of patients who just started to walk on their lunch break, especially since it's gotten nicer, and seen significant improvement. We do those in-bodies in office, so we can literally see that there has been improvement in fat loss, muscle building, just from literally adding in walking. Wow. And it's baby steps. Like we don't want to just stay at walking forever. We need to add in the resistance training, things that are important. But like starting with that can't be like it's really important, and it's such an easy first step. The strength training, the eating protein, sleep, all those things that we've talked about a million times. They matter a lot, but it's those foundational things. You get those 5 things under control, you're going to be doing really well.
Right. So prevention shouldn't really be viewed as an expense, right, Dr. Calla?
No, not at all. It's an investment, and people often hesitate spending money on healthy food, gym memberships, coaching, that recovery care, supplements, proactive labs, or even just movement program. But they won't blink later when they need a surgery or a medication, injection. Hospitalizations are very expensive, or chronic disease management. So when we really do like the math long term, doing a $50 a month gym membership is going to pay so many dividends later. Right. One of the things too, when it comes to healthcare, a lot of patients, even on a high deductible, they're like, well, I want to use my insurance. And I have to coach people on, here's the deal. I don't want to use my insurance. So if I go to a provider that is in network with my insurance company, they have to bill me what the fee schedule is. So the easiest analogy is most vitamin D fee schedules, regardless of the insurance company, the fee schedule is $150. Well, we run labs in our office, and we don't submit to people's insurance because they're not symptomatic enough.
Sure.
We don't want to do the baloney paperwork
Yeah,
to
right.
get it covered by their insurance. But patients that have the high deductibles, we can get vitamin D for $20.
Oh, wow.
We can get a complete thyroid panel for $65 to $85. But if I go down the street to an in-network lab, a complete thyroid panel is like $485
That's
on that
insane.
fee schedule. So when patients are looking, I encourage, especially if it's a year that you don't want to hit your deductible, ask for the concierge healthcare providers, ask for the out-of-network that don't participate, because a lot of the times we don't make money necessarily on those labs, but the lab down the street, they're making a lot more because it's not that cost. It's not a high cost to produce the result.
Right.
So we have to remember, insurance companies, it's a business to make money. Most lab centers, it's a business to make money. We need the lab so that we can guide and coach. And so where our profit center is people paying us for the direct one-on-one time.
Yes.
I don't have to work for your insurance company. I don't have to play for their rules.
I love that.
But it's important, though, that we have the trust and, conversation of, is this lab testing necessary? Is it helpful? Is it useful? I have some patients that they want to get like a full body MRI. Thankfully, if they want to, they actually can. It's just cash pay.
Yeah.
So just kind of using your healthcare dollar wisely. But again, when patients are coming in and let's say it's December and somebody has a really bad low back and they've been dealing with it for a while, I encourage them, I'm like, let's wait till January before we get this imaging so that it'll at least count towards that new calendar year, that
sure.
deductible. But if it's, December 21, I'm like, we can wait 7 days. You're not that
got
bad
this.
yet. Just to be wise on how that
Yeah.
healthcare dollar is spent and used.
Yeah, managing your health and managing your finances at once, keeping in mind that there's a bigger picture. Those are all really important. So I think maybe the big takeaway is this: the healthcare system is incredibly important, but our personal daily habits are still the foundation of long-term health. Movement, nutrition, hydration, sleep, stress management, muscle mass, recovery, those aren't wellness trends. I get it. They sound like they should be, but ultimately they should be part of the fabric of our lives. They're foundational human health principles, and the earlier people start investing in those things, the more likely they are to avoid becoming dependent on the healthcare system itself later on. In the book of 1 Corinthians chapter 6, verses 19 and 20, it says what? Don't you know that your body is the temple of the Holy Ghost, which is in you, which you have of God, that you are not your own? It says you're bought with a price. Therefore, glorify God in your body and in your spirit, which are God's. Acts 20:28 tells us that the price that was paid was the precious blood of Jesus Christ. That's the price that you were bought with. Knowing that we should treat this body as a temple. It's literally the temple of the Holy Spirit. And yeah, in spiritual matters, that's important, but it also matters in the physical realm. I think that's a great place for us to end today. Take care of your body before you're forced to, and don't forget to take care of your mind and your spirit too. Thanks for tuning in. We'll see you on the next episode.
Thanks for joining us today on Whole Health. If you'd like to learn more about our program, have a question for our hosts, or want to find past episodes, just head to wholehealthlive.com.